Okay, hopefully we're live and hopefully you can hear me and Lily can tell me yes or no. I was just giving conference to the faculty and fellows and residents, and my computer sound seemed to die in the middle, but hopefully this one's working fine. Okay, so I'm going to show you, this is Pancreas month, so I'm going to show you basically 10 pancreas cases. This is one of the cases I just showed. Very large mass, it's kind of solid. Maybe it's off the stomach like a gist or retroperitoneal sarcoma. But this was off the tail of the pancreas, so it's kind of a large necrotic tumor. What else gives you such a big tumor with prominent vascular involvement? There is one type of pancreatic cancer. It's an unusual tumor. Satomi Kawamoto is writing an article about it. Undifferentiated carcinoma with osteoclastic features. These are large, they're aggressive. Patients typically do poorly. A very unusual appearance, a very large pancreatic mass. Best diagnosis, cystic lesion, tail of pancreas, maybe thin septations. Doesn't look like an IPMN, there's no dilated pancreatic duct. Maybe it's an MCN, mucinous cystic neoplasm, theoretically an oligocystic serous cystadenoma. Maybe a thin septation. This was an MCN with low-grade dysplasia. We're working on AI for determining dysplasia. Some people feel that if it's under 4 cm now, you can watch cases. Most of the classic thinking is that every MCN will become an adenocarcinoma, so everyone needs to be resected. Another case, cystic lesion, very much like the prior case, but the difference here is you can see thickening of the wall and what looks like wall enhancement. So now you have a cystic pancreatic lesion with rim enhancement. Well, MCNs can have some enhancement. Serous cystadenomas have draping vessels. IPMNs do not, unless there's atypia or aggressive tumor, and then it's focal nodularity. But the one thing we always forget about, sometimes they're small, sometimes they're larger, like this case, is neuroendocrine tumors. So cystic neuroendocrine tumors, cystic lesions are, think about neuroendocrine tumors when there's a thickened wall, particularly with enhancement. Another case, solid mass tail of pancreas with faint calcification. The lesion is somewhat vascular, but doesn't wash out much between arterial and venous phase. You can go through a differential. Solid serous cystadenoma is a possibility. Other solid tumors. This was a great case. This was a neuroendocrine tumor. Again, calcification, you always think of neuroendocrine tumors, though this is the most minimal calcification possible. Neuroendocrine tumors can be very vascular, but not everyone is very vascular. As we mentioned the case before, we had a cystic lesion. Left upper quadrant pain, 34 female. Differential, a serous type tumor is a possibility. MCN is a possibility. The other thing to consider, cystic and solid in a female, though it's a touch above the typical age group, would be a SPEN tumor. Here you can see, we'll disregard the uterus with fibroids, solid lesion, nodularity, solid and cystic SPEN tumor in a 34-year-old female. Most patients are teenagers, but we see them in all sorts of ages. And again, female to male is about 9-1. Another patient, cystic lesion, septation, some nodularity. Again, you got to think about SPEN. You could think about serous cystadenoma. Doesn't have the look of a neuroendocrine tumor with just that one septation and really no wall enhancement to any degree. And that was an MCN. So again, you can see there's lots of overlap. Septations make me think of MCN, but you may only have one septation, thickened wall, enhancing wall, MCNs, neuroendocrine tumors. Again, the overlap to things like SPEN, where there's more solid nodules, and SPEN occasionally can have more enhancement, but it can be somewhat challenging, which is why we do EUS and why we do surgery. Another patient, head of pancreas, complex cystic lesion, thickened walls, septations. You're thinking serous cystadenoma all along. There may be some draping of the vessel of the patient's GDA. And serous would be a very good thought, but again, cystic and solid septations, you got to think about a SPEN tumor. SPEN's a great mimicker. We don't see more than a handful a year, but every one of them is challenging. If you have a SPEN tumor and you have a 15-year-old female, it's really easy, but when the patients get older, you often do not think about SPEN in your differential diagnosis. In honor of Pancreatic Cancer Month, I show this case: atrophic body and tail of pancreas, dilated pancreatic duct, and what looks like a small subtle mass here. These are the tumors you can't miss. Even if you don't appreciate the tumor, when you see duct dilatation, glandular atrophy, and you see a transition, you got to be thinking about pancreatic adenocarcinoma. And this was a case of about a 1.5 centimeter, and maybe it should be less than that, pancreatic adenocarcinoma. Another patient, left upper quadrant, cystic lesion, septations, focal calcification, serous cystadenoma is a thought. I don't like it for a SPEN tumor, but I can't exclude it. Remember, SPEN's a variable, and they can have calcification that's variable. MCN has septations, not a bad location. Can have calcifications, they're usually in the periphery. You can see a little bit of the septations here, perhaps, but this was a serous cystadenoma. So you can see it can be challenging. Remember, serous cystadenomas, unless patients are symptomatic, you could leave behind because the patients do not develop malignancies. Mucinous tumors, they invariably become malignant, particularly when they're over 4 cm. So we are trying to use AI to better distinguish between these various tumors. Another patient, back pain, mass tail of pancreas, coarse calcifications. Mass with coarse calcifications, we always talk about neuroendocrine tumors. Yes, I could think about SPEN, I could think about MCN, I could even think perhaps about a serous tumor, but it really makes me think in this case, when I look at everything and the solid nature of the tumor, that I'm dealing with a neuroendocrine tumor, which this indeed was. And that's 10 cases. Pancreatic Cancer Month is very important as we raise the awareness, and we raise the awareness of how we need to be better at detecting pancreatic cancer and managing patients. And with that, have a great day, everybody.